A great honor to be here. I hope by being here I can help stimulate new research that has a complementary effect on the work that's been done up until this point by many very good people here, many of them who are on the stage and others in the audience. Since this has been a recognized problem for not a very long time in some people's minds, but obviously in the patient's mind, much too long a period of time. So I've learned a great deal in the last 24 hours since arriving. I have learned from the patients primarily the devastation of their disease. I've learned from the physicians taking care of them how frustrated they are in not having any solutions, and in fact, in seeing the patients at advanced stages of their disease when they're symptomatic, since unfortunately renal disease in general affects people in a way where they don't know about the disease until it's very far along, and at that point we can do little to help them except watch as they get worse and worse. Knowledge is power, and knowledge in this area is the ultimate power to do something that is going to be beneficial for this group of patients, but also beneficial for the worldwide population that's increasingly affected by chronic kidney disease. So I'm here to try to help, to try to instigate increased work in this area with this population, and to increase primarily fundamental research and early recognition programs, and then ultimately what I think is going to be critical, a preventive disease strategy, which will also be importantly involve public education. So with that, I've got a few slides. Dr. Sabasetti mentioned a number of the things that I will mention. I'll potentially reinforce what he said by having a little different slant on the same issues. So we're dealing with a problem. He mentioned Mesopotamian nephropathy, Mesoamerican rather, nephropathy. He's mentioned Balkan nephropathy, and obviously he's mentioned the problems more locally in Uddanam and also in Sri Lanka. And he's mentioned some of the characteristics of the disease, but this is a list of my information that I've gleaned from the literature and from the last 24 hours, and certainly needs to be refined as we survey these patients, as Dr. Sabasetti has said, survey these patients and learn not only more about what their disease is characterized by, so-called patient phenotypes, but also learn more about what medications they've been taking, what over-the-counter types of drugs that they've been on. Some of them I can surmise here for quite a long time because of the fact that they have pain in various areas, and that becomes a process that only worsens the progression of the kidney disease. In some areas, we know, at least from some of the information we have, that it may be as prevalent as 40% of the adults, but these are unpublished right now, and even that may be an underestimate. All ages seem to be affected, although it's more common in the third and fourth decade. My colleagues can correct me on some of this, but I've also heard anecdotally that children are affected. It's said that males are affected more than females, but in fact, in some of the numbers I've seen, I'm not sure that that's correct. There seemed to be much more parity between males and females, and often individuals with agricultural jobs, but that may not be related specifically to agricultural components, but may be just an association of the characteristics of the individuals who are prone to the disease. They may be more likely doing agriculture.